Well, I think also before the pandemic and working on different continents with different governments, I think many countries are basically facing a problem with efficiency of their health systems. Efficiency in general is obviously a topic of economic resilience, also after the credit crisis in 2008. But especially in healthcare, where we see lesser resources in terms of number of people available for providing care. A lot of countries the budgets are under pressure. And in parallel, we see a higher demand on care. So if you have to do more with less, the only thing you can do is to increase efficiency. So in broad terms, this is the major challenge. And of course, the other part is to make it more effective. So besides the options you have in terms of infrastructure, on training of people, etc., and using appropriate treatments, is the way how you improve operational procedures, collaboration, making it more efficient, the interactions better, and where you can do to automate processes where possible. Then, yeah, digitalization is the biggest promise, I should say, we have in order to establish this. So this is in many countries, also in a Western, well-developed healthcare system, a challenge, because if you look to the Netherlands, for example, we have a wonderful infrastructure, we have all the resources where you can think of in terms of digitalization. But still, it's highly fragmented. Hospitals, primary care, chemists, all kind of stakeholders in the area are often still faxing rather than sending digital information, using digital information in order to improve work processes. So it's all around, and of course, each with their own different context. It's like changing 1,000 pieces puzzle.
Yeah.
And the challenge here, this is 3D puzzle basically. You're talking about different dimensions in this in healthcare, with finance, digitalization, with people, with service aspects, and it's also from different levels. So you have the operational street level type of care provision, but it's very much depending on how it's organized from a systems perspective. So you have the local level, the regional level, you have often national frameworks on which the real practice, day-to-day practice of care is depending on legislation, rules, regulation, finances. So in this multi-level, multi-dimensional environment, to change something, it's really a hell of a job. And although some people think, oh, if we can change maybe some indicators or some financing models, you're changing some pieces of the puzzle, but that won't change the puzzle as a whole. It's all interconnected, or many things are interconnected. So this is the biggest challenge. So it's neither a top-down process or a bottom-up process alone. It's the combination of these things. And it's not only about digitalization. It's about people and how you organize this between organizations. Financial aspects, it's health and social care related. So accordingly, to have this integrated approach on how do you improve a healthcare system in a way that it's understandable, it's engaging, and effective implementation. It's not very easy, and it's all very context, cultural dependent. So different regions might also use their different sort of approaches and etc. So this systems change is, I think, the main challenge, because we know that only changing a couple of pieces of the puzzle won't change. And we also know that the good examples, the good pilots we have, the good practices, they often don't scale up. So you need to have to think from a systems perspective on how to change. And this is not very easy because many pieces of the puzzle need to be aligned in a sort of transformation process. So I should say that's the most difficult thing. Related to the previous question and my answer, also the industry, companies such as Roche do see, okay, if we really want to build a sustainable model for our company for the future, we have to look how to support this change. Because also healthcare finances are under pressure, there's a higher demand. A lot of the industry, the companies do have solutions available, but like Roche, if you working on diagnostics or treatment solutions, it's often very dependent also on other actors and also other industry partners in order to make the full solution work, in order when it comes to better outcomes. So not only about sales for the specific product, but now that increasingly the financing models and the business models is more outcome related, you have to think on how do my solutions fits in a total network of providers and actors and also the patients. So along this thinking, Roche as a company is already thinking about a strategy on, okay, how should we move forward? And what can we bring as a company to typically settings, ecosystems, in order to help them change, where they're also a piece of the puzzle, but a very resourceful piece of the puzzle with knowledge, worldwide distribution network, a lot of experience. So in this thinking, it was okay if we look to all kind of health plans, health improvement plans related to personalized care, integrated care. So what do we know? What are the typical sort of topics countries are discussing? How do they see this change in an improvement of health? So for this program, we evaluate almost 100 health transformation plans related to digitalization, personalized healthcare, comprehensive cancer care, and took out, okay, what are the aspects which are seen as relevant, both from a public perspective, both from a private perspective. And we put this together in a sort of overview and combine this also with the experience of Roche in different areas. And eventually we came to a sort of building blocks framework by which we see 4 domains, which are related to, let's say, the vision, the strategy, the enablers, the service level, the typical products which should fit in the services such as technology, diagnostics, medication, etc. And also how digitalization is connecting the different elements. So we use these 4 domains and the related building blocks, which in total are 50. And we use this very concretely with with ecosystems, with locality settings in different countries. And currently we're running programs in India, in Russia, in Germany and Romania, and starting off in Brazil. And we're using this framework for mapping the context, using as a sort of discussion, ingredients for discussion with the stakeholders on how they see different elements, for example, in the service, and what is missing, and what is going well, and what could be improved. So it's also, in this sort of ecosystem approach, it's helpful to bring the stakeholders together, use discussions and a sort of mapping in order to start, okay, where should we improve? And if we improve, what do we achieve? And who do we need? Or what we shouldn't do anymore? So it's, I think typically this is very related to this sort of overall system change. You have all these elements on the different levels and the different dimensions. And according, if you look into a certain context, all these things matters. But in order to make the concrete, you have to really talk with the people on the ground floor, but as well as also with the financiers, the people who are responsible for regulation, the authorities, in order, if we want to achieve this change. So what do we need? How things are running and what we should do differently. And I think I think also a radical change to, let's say, 20 years ago, was where the sort of needs of the patients are leading in the process. So we use this patient perspective and the patient needs along this journey to have a start about the discussion. And further on, then the different stakeholders talk with each other on their perspective. But already this process and the talking is a sort of start for change. And we use this, let's say, building blocks as a sort of support in order to cover some of the elements and to basically build, have from the existing system a new system. So in that way, we have the experience, but we know it also from some other examples that such an approach, which is sort of co-designing, co-creation, very trendy words, of course, and the sort of process service orientation and the patient story in this as a sort of leading process methodology in order to make the change happen. So also the sort of lessons from these discussions will feed into higher structure from finances or rules and regulation on, okay, what do we need from higher systems level in order to make this change happen?